Common ones that we see in clinic are impingement, where one of the tendons at the top of the shoulder gets pinched underneath the roof of the shoulder blade due to faulty mechanics in the shoulder. Tendonitis is another one, so one or more of the tendons in the rotator cuff muscles become inflamed or damaged. Frozen shoulders as well. If we're talking about the area at the top of the shoulder blade that leads to the neck, then these days with people spending lots of time hunched over computers and shrugging their shoulders for long periods, very common to see them developing knots and tight muscles in those shoulders that we will need to try and release off them. If we're talking about one of the tissues near the surface of the shoulder, such as the tendons or the bursa, we think they've become damaged, then the best investigation would be an ultrasound scan, which can look at great detail at those structures. But if we suspect something deeper in the shoulders, let's say a torn capsule or torn labrum as it's called, then the ultrasound won't go deep enough to see those structures, in which case a special type of MRI scan called an MRI arthrogram is the best type of investigation. We use lots of deep massage, so we'll do lots of massage with you. We do a special type of acupuncture called trigger point dry needling to release off the deep knots and trigger points in the shoulder. We'll also teach you rehab exercises, strength exercises for the muscles in the shoulder. If we find out that you've got calcium deposits within the tendons, or if there's inflammation in those tendons, then really one of the latest forms of treatment that we offer is shockwave therapy, which can be very good for those particular conditions. On the other hand, if we find that there's actual tears within those tendons, or there's other tissues in between those tendons which can become inflamed, for example, bursal tissue, called bursitis, then that's really best sorted out with an injection, and we will refer you to a consultant radiologist that we use, who's very good at what he does, and he uses ultrasound guided injections to help promote the healing within those damaged tissues. Avoid rounded shoulders, because that puts the shoulder blades in the wrong position and therefore the socket itself will be in the wrong position. Secondly, I would say make sure you're exercising the small muscles in the shoulder as well as the big ones. So most people are aware of the big muscles around the shoulder, the pecs, the delts, the lats. So if you go down the gym and you're doing all that, fine, but make sure, I would say, you're exercising the small muscles, the rotator cuff muscles in the shoulder. They are essential for keeping that shoulder socket securely in the middle of its socket, and without that you risk damage. And I would say even if you haven't got shoulder pain, really you want to be doing those exercises as part of your exercise routine.
Thank you for watching this video all the way through. For effective treatment and advice for muscle and joint problems throughout the body at either of our clinics in Chigwell or Woodford, call us at Spine Plus to book an appointment on 0208 501 0937. You may like to know that we've made several other videos with information and self-help tips on specific problems, everything from tension headaches to heel pain. Some of our suggested videos are shown below, or you can search our playlist to discover more. We'd also be really grateful if you could like and share any videos you watch, and please subscribe to our channel by clicking on the subscribe button to be kept informed of our latest information. For more information on our clinics, click Find Out More to be directed to our website.